Have you ever faced a claim denial for neonatal sepsis? If so, you are not alone. So this problem has been around for over 2 decades. Let us explore the scenario and let's make preventive steps, okay, on how to avoid the denial of the claim. Now, I want you to picture this. A mother gives birth to a baby boy. Her medical history suggests that she might have had infection. So to ensure safety, the pediatricians treat the newborn as potentially septic baby, even if the signs and symptoms are not complete. Take note, the term is potentially septic. Now, let us say 2 days later, the baby is well and eventually discharged with a diagnosis of neonatal sepsis with a code of P36.9. Now, everything seems well, okay, until the hospital files the claim with Philhealth and it gets denied. So the question, what happened? First, let's understand that the pediatrician took preventive steps, which is commendable. Now, the intent was to protect the child from a potential health threat. On the other hand, Philhealth's position is also valid. They expect quality service based on clinical standards. Since the protocol for neonatal sepsis requires a blood culture which wasn't done, from their viewpoint, the quality service was not delivered. Now, the central point of the issue is the term potentially septic. It means there is a possibility of sepsis, however, it is not guaranteed. Clinically, preventive intervention is possible. Yet, when it comes to insurance, such terms can be very tricky. The word potential may have no value. In this case, the insurance will question the diagnosis because the baby was discharged early. There was no blood culture done. If the baby was septic, 2 days confinement is not enough. And another thing, when translated into ICD code, potentially septic is understood as neonatal sepsis or sepsis of the newborn. Now, this confusion is just a minor inconvenience to everybody. It affects the doctors, it affects hospital management, and most importantly, patient care. Now, but with few simple steps, we can actually bridge the gap. Okay? First, awareness and training. Hospital management should prioritize educating the medical staff on Philhealth rules, particularly those that are often misunderstood or overlooked. Philhealth will look for quality services. Here, your keyword is Clinical Practice Guideline or the CPG. Next, clear documentation. Always ensure that the terms used in the diagnosis are clear and specific. If the baby is potentially septic, then converted to a neonatal sepsis, always validate the treatment in the documentation. Now, the third part is this: communication. Foster an open line of communication between doctors and hospital management. When both parties understand each other's perspective, they can work together to ensure that procedures, diagnosis align with the insurance expectation. This challenge is not new. It has been around for almost 2 decades. But with the right understanding and proactive steps, hospitals can reduce claims denial and ensure quality care for patients and create harmonious working environment of all healthcare professionals involved. My friends, I hope this helps. This is Coach Doc Ben. Follow for more tips